palpation of the muscles, we palpate the medial malleolus, and posterior to medial malleolus, we palpate the three muscles. First is the tibialis posterior over here, flexor digitorum longus, and the flexor hallucis longus over here. For palpation of the sternals, we ask the patient to do the registered isometry. For palpation of the tibialis posterior, we ask the patient to do plantar flexion and inversion, and we have to register them. And we easily palpate over here muscle, tibialis posterior. For palpation of the flexor digitorum longus, we ask the patient to do flex the fingers, and we isometrically register them, and we easily palpate the muscle over here. For palpation of the flexor hallucis longus, we ask the patient to flex the great toe, and we have to register them, and we easily palpate the flexor hallucis longus over here. Anterior to the medial malleolus, palpate the tibialis anterior, extensor hallucis longus, and extensor digitorum longus over here. Tibialis anterior, ask the patient to do dorsiflexion and inversion, and we have to register them. Extensor digitorum longus, we ask the patient to do extension of the toes, and we have to register them. For palpation of the extensor hallucis longus, we ask the patient to do extension of the great toe, and we have to register them and palpate over here extensor hallucis longus. Palpate the medial malleolus over here, prominent part. Same, we palpate lateral malleolus on the lateral side over here. Palpating the medial malleolus and the lateral malleolus, follow the anterior line joining. In the center, this is known as the talar draw. By doing plantar flexion and dorsiflexion, we palpate the talus bone, medial malleoli over here, and goes anteriorly and down. This prominent part is known as the navicular tuberosity. This is palpated over here. If this palpated down, so it is known as the navicular drop, and which is present in the flat foot patient. Palpate the metatarsals over here. This is the first, second, third, fourth, and fifth. The fifth metatarsal over here and goes laterally. Most prominent part feels over here. It is known as the fifth metatarsal hair, and fracture of this is known as the Jones fracture.